Hey, Dr. Alan Christensen here with you. I want to talk about the 11 most critical thyroid symptoms. Now, this is an important, valuable distinction. So your thyroid gland, it does pretty much everything. Every cell in your body has to generate fuel and has to eliminate wastes. And how quickly it does that is controlled by the thyroid hormones. It also affects how you rebuild proteins, those that make up muscles, tendons, ligaments, skin, hair, nails. The thyroid controls all of that stuff. And because of that, people have acknowledged that your gland can be behind any symptom imaginable, pretty much literally so. So the drawback, though, is that so many symptoms happen even not because of your thyroid. So the thyroid can affect all these things, but other factors can too. So we want to distinguish signal from noise. And this is important both for those who think, hey, I wonder if my thyroid is a problem, but also for the population that knows they've got thyroid disease and they want to make sure that they're doing everything they can for their thyroid. It's big for both groups. So the drawback about many lists I've seen of possible symptoms is that if you look at those and you think about those seriously, that's going to be all of us. We all have something happen every day that falls into that list. And the drawback is it can make you feel like you've never really succeeded in getting on the right thyroid treatment or doing the right things to heal your body. Or you're always thinking it could be a problem even when it's not. So it's too much signal and too much noise and not enough good quality signal within that. Now, one thing I stumbled across, which is really great, was the Colorado Thyroid Prevalence Study. This was done back in 1995, and they looked at 24 some odd thousand people. They gave them surveys saying, hey, have you had these particular symptoms? And actually, some of these were open-ended too, and they could fill in other symptoms. But they also did blood tests in everyone. Now, something they could have done better is that they used pretty conservative guidelines for saying, are you normal or not? What I mean by that is you had to be really off to be flagged as being low thyroid or high thyroid. Normal was a pretty big barn door to hit. So had it been done perfectly, they could have made more refinement and caught people that had, autoimmunity or subtle abnormalities. But in a weird way, a way that it's almost good the way they did it is that we got a more clear sense of what were the obvious symptoms when it was off by a lot. So it gave us more refinement. And if you have this symptom, there's clearly a problem. And so a possible benefit is some of the more subtle symptoms got weeded out. And what left us behind were symptoms that can be clearer roadmaps, clearer things to put more weight in. So what was the list they came down to? Well, that was deeper voice, more constipation, hoarser voice, hoarse voice. Distinction there, we'll talk about that. Puffier eyes, feeling colder, muscle cramps, feeling more tired, slower thinking, weaker muscles, and drier skin. So what's this distinction about like hoarse voice versus hoarser voice? Well, that was interesting. They asked about a lot of static symptoms like hoarse voice. But if you listen closely, almost all those were dynamic symptoms. Hoarser voice. That means that how I feel now is not how I felt in the past. And that's a big distinction. So especially if we're thinking about someone developing a thyroid problem from scratch or from having thyroid disease that's no longer well controlled, think about evolving, changing symptoms. And a real common pattern is someone says, hey, I'm cold all the time. I'm tired for no clear reason. Like, okay, have you always been like that? Yeah, I guess that's always been me. Like as a kid, I guess I was always wearing sweaters or whatnot, never really did a lot of physical things. Okay, that's important, and we want to understand that. Wouldn't necessarily point as strongly towards a thyroid issue. But that same scenario, someone says, hey, I'm just cold all the time and I can't get my butt going, I don't know what's wrong. And like, okay, has that been long-term for you? No, not at all. I'm thinking somewhere around like last September, there was this change that happened in which I first noticed it and it's been getting worse and worse since. Like, wow, okay. So that's an evolving dynamic symptom. That changed over a clear time frame. So that's more likely to be thyroid related. Now, some more nuance with that symptom list. They gave numbers on the sensitivity and specificity. So what that means is how many people that had abnormal thyroid levels had that symptom, and then how many that had abnormal thyroid levels that did not have that symptom. Okay, so this is an important difference, and this is a big thing too. So the first part, there was a lot of these symptoms that were shared by 90%, 70%, 80% of those that had bad hypothyroidism. So a lot of them overlapped. However, there was very few that were rule out symptoms. So what I mean by that is, if you didn't have that symptom, that means you wouldn't be in that category, like a double negative. So say the hoarser voice. So if someone said, hey, I do not have a hoarse voice, how well could you predict their thyroid was fine based upon that? Not very well, because 2/3 didn't have that, even though many who did have it did have that symptom. So it's different on one side versus the other. And that's important. What that tells us is that you can have problems with your thyroid, and you wouldn't have all the same symptoms that someone else who does have thyroid problems would have. You know, many times I would see someone who was not suspecting they had thyroid problems, but their scores showed they did. They had a high TSH, they had high antibodies, they had problems with their ultrasound, and sometimes this was just screening purposes. And they would say, oh wow, you know, I've heard about people gaining weight or whatnot, but I've not really had that. How could my thyroid be wrong? Well, that's how it works. You don't tend to get all of the symptoms. And it's very common that you may not have a symptom that seems like a very important one, like the weight gain, the hair loss, the dry skin, the fatigue. Many people don't have one or some or all of those symptoms. And that's actually how it works. So it's like a unique combination from person to person. So if you do have some of these 11 symptoms, what do you go about doing to take care of this? Well, for starters, get very thorough testing done. You know, get all the blood tests, get especially TSH, free hormones, thyroid antibodies, the thyroglobulin as well. Reverse T3 can be useful, but get a full gamut. And there's this normal range, there's also optimal ranges. Now, optimal ranges, the biggest study done that I've seen, took people and basically pulled out everyone with any possible thyroid problem and then checked them over and over and over again. And the biggest difference between normal and optimal, well, a couple big differences. So thyroid antibodies, many labs say you're normal to have low thyroid antibodies. That's not normal. That's not okay. That's not healthy. It's not desirable. So thyroid antibodies should be 0 to be normal. If a lab says thyroglobulin below 32 is normal, no, you're not. If you're 25, that's still a problem. But it's so prevalent that labs made it normal just because it was so common. But really, it is a problem even though it's common. So that's one difference. The other big difference is actually the TSH. So normal ranges now can be most commonly 0.45 to 0.4 to 4.5. Some say 0.45, but basically 0.4 to 4.5 is the most common range. Some labs say 5.5. You know, back in the 90s when I started practicing, 10 or 12 was the upper limit of normal. It's come down. But the tests that I referred to, the studies that looked at optimal healthy people, they never saw TSHs above 1.9. So that's a big difference between normal and optimal. The free hormones, the free T3, the free T4, they're not that different between normal ranges printed on the lab slip and the optimal ranges found in the studies. So those are not a big distinction, but the antibodies are and the TSH is a big difference. So you want them optimal. And if they're not, that's a matter of looking at what are the big root causes of thyroid disease for you. If they're off by good margins, say your TSH is actually elevated, there's probably a case for thyroid replacement therapy helping you. You may not be needing it long term, but it can make a big difference for lowering inflammation and actually healing the gland if it's done right. And I'd also argue that all the causative factors are critical. You want to really go deep into how's your digestion working? Are there toxins you're carrying within your body? Are there pertinent genes that are affecting all this you need to be aware of? Is your adrenal rhythm healthy or is that off in some way? You know, how's your gut flora? You know, which foods are the best fit for your system? These are all important questions to answer on your journey back to good health. And a last thing I would say is an action step. If you're not already, do consider natural desiccated thyroid. Clinically, I've seen the vast majority of people do better with that in terms of symptom improvement, easier time managing their test scores, and also lowering their antibodies. But I would say there is a brand issue. So some brands are not well standardized. Some brands do have binders or fillers. I'm a big fan of WP Thyroid because it's well standardized, it's clean, it's got T4, T3, and T2, and then no big binders or fillers. So take those key steps. But yep, thyroid symptoms are important. Know about the possible symptoms, but think a lot about those probable symptoms. They're the big ones to say, hey, you've got to course correct if you're on treatment, or hey, you should be addressing this if you're not. Take great care. We'll talk in really soon. Dr. Christensen off.